Hi, everyone. Thank you so much for joining us. I'm Kiera Butler. I'm a senior editor at Mother Jones, and we're going to be talking today about an exceptional new documentary called Totally Under Control. It's about the unfolding of the coronavirus pandemic and the abject failure of the Trump administration to address it. The film was directed by Alex Gibney, Suzanne Hillinger, and Ophelia Harutyunyan. We're lucky to have Ophelia here with us today. She's an accomplished documentary maker who's worked on many other films, several with Alex Gibney. Our other panelists are Kristin Urquiza and Fiana Tulip. They're activists from the group Marked by COVID. That's an organization that works to tell the stories of people who have lost loved ones to COVID-19 and to hold the US government accountable for those deaths. Kristin founded the organization and named it for her father, Mark Urquiza, who passed away from COVID. Fiana joined the organization after losing her mother, a respiratory therapist, to the disease. So we're looking forward to a really exciting and dynamic conversation with our panelists today. And if you have questions, we're going to save a whole bunch of time, the last half of our time together, for those questions. So please put your questions in the chat, and they will be collected, and we'll answer them after the first part of our discussion. So I wanted to start out with a question for Ophelia. Ophelia, can you tell me a little bit about how the idea for this film came about and about your personal inspiration as you work to put this incredibly thorough documentary together in like a matter of months?
Hi, thank you for having me. So around April, when we're all New York based, Suzanne, Alex is New Jersey based, but he works in New York. And around April, we were living through worst of New York. I mean, New York was the epicenter. We knew a lot of people who were affected by the disease, and we were all feeling pretty kind of helpless. We wanted to do something, and as documentary filmmakers, we knew that maybe we could do something by actually researching this issue and maybe making a film. And so actually, I was checking in with Alex to see how he was doing because I was concerned about him. And then he said, I'm actually thinking about doing this documentary. And I thought it was a great idea and didn't think much of it. And then he reached out maybe a week or two later saying, do you want to direct this with me? Because this is going to be a huge undertaking. So he had actually reached out to me and Suzanne Hillinger because we wanted the film to come out before the elections, not for any political reasons, but because everything that we had read thus far, we knew that, okay, something's wrong, that this can't be the right response to this pandemic. We had read enough to know that the government wasn't responding in their best way. So we really wanted to dig into the truth, find out the facts, and present them to the public before they make a very important decision. And so the three of us started working on this film in the beginning of May, knowing that we only have 5 months to finish it. And if anyone has made a documentary, they know that it takes at least a year and a half to make a film like this. And we just had an amazing team, and we're able to put this out in 5 months. And hopefully people are getting to see it, and it's making an impact.
Yeah, that compressed timeline is pretty impressive. Kristin, my next question is for you. I wondered if you could tell me just a little bit about your organization and what led you to found it.
Sure. Thanks so much for having me, and excited to be here with all of you today to discuss this. I launched Marked by COVID on June 8th. It was the day that I buried my father July 8th, which was the day that I buried my father who had passed on June 30th. And what drove me to launch Marked by COVID was at that time, we were seeing incredible spikes in deaths due to COVID, which were linked to the cavalier reopening of our economy, really forcing this false narrative that we had to choose between public health and economic health. My dad got caught up in that and sadly passed away. And I kept on seeing these numbers on the television thinking, we're talking more about this from a statistical standpoint, and we're losing the human aspect of this. And I thought back to what made a difference in the AIDS crisis, which I was young, but I remember very vividly the quilt on the National Mall, and how that really helped personify the loss. But then also, as I grew older, I read more about what happened during that movement and sort of put the pieces together to realize we need a national COVID movement, not only to prevent more people from dying, but to ensure that this never happens again, that folks who have lost loved ones are recognized and honored, and that we also have a just recovery response restitution to this crisis. So I decided to, take a step forward and share my story. And I encouraged others to come forward as well. And luckily, Fiana, she was one of the first people to say, I see what you're doing. I just lost my mom. And this is the only thing that makes sense to me. Like, can I help? What can I do? And it was in that moment that it really did solidify for me that this movement was absolutely needed, not only to honor those that had been lost, but to provide support for us who are living through this and mourning during a time in which we don't have our traditional mourning mechanisms available to us, and where there's no end in sight, and the people in charge continue to downplay the loss of our loved ones.
Thanks, Kristin. My next question is for Fiana. Fiana, maybe you could say a little bit about your own story, what led you to join this movement. And I also wanted to hear from you how you felt watching this film as somebody who has lost a loved one to COVID.
Yeah, thanks. Thank you for having me. My mom was a respiratory therapist in Dallas, Texas, and she was the strongest woman I knew. So when COVID took her life in less than a week, I knew something was wrong. It didn't make sense to me. It didn't make sense that my mom lost her life at 64 years old. She was young, she was energetic, she was on her feet all the time as a respiratory therapist, and she needed to be here. I just had a daughter, and she was the happiest grandmother I've ever seen. And it didn't make sense to me, not to have my mom here. So a friend of mine sent me an article about Kristin and what she was doing. And I thought she was so brave. And I was just like, wow, I need to tell her that. I need to commend her, because I wish I could do what she's doing. And so I reached out to her and I told her, our parents didn't deserve to die. And I love what you're doing. And, and like she said, I asked if I could help, but I didn't think that she would ever read the message and that I would actually make this my 24/7 role. And I love it. It happened. And, after that message, my life changed, and it's exactly what I need to be doing. And I know that. I know this is the perfect way to grieve the loss of my mother, and that's taking action and getting justice for her. And so watching this film, I've watched it a few times, and the first time it was hard, and I was scared to watch it because it's all things I know, but to be reminded of how much wasn't done to save the 220,000 plus people, it breaks my heart. And to know that my mom was one of those people, it hurts. And watching it, I see every step of the way where our leadership could have done something different, and they chose not to. They chose to discount my mom's life in the race to reopen the economy and for political reasons, and to think that my mom's death was political. And after watching that movie, to know it was political, it was hard. It just makes the movie just makes me want to turn back time and have new leadership and just redo it over, because my mom could still be here. And I know that.
Thanks, Fiana. For me, one of the central tensions in the movie was kind of the juxtaposition of what scientists were telling our leaders and what leaders said. So my next question for you, Ophelia, it seems that the film does a great job showing that from day one, scientists knew much more about this disease and were much more concerned about the potential for pandemic disaster than the Trump administration let on. So can you talk a little bit about setting up those juxtapositions in the film?
Yeah, I think pretty early on we did find the theme of the movie, science versus politics. And what we found out was that there was just a lot of information about what to do during a pandemic. I think none of us had lived through a pandemic. So we, as the general public, we weren't sure what to do. That's why we look up to the, public health experts and the scientists for guidance. And these people knew it because, and even very recently, October of 2019, they had done an exercise called Crimson Contagion, which was a simulation of a very similar virus coming out of China, spreading to the US and the entire world. And what it was a federal run exercise. Of all the agencies, the agencies that needed to deal with a pandemic, they all participated. They all knew what the issues were within themselves. They all knew what to do during a pandemic. There was a report that was done, after the exercise. So this was October 2019, right? And so only like 3-4 months later, this virus emerges. So this information should be very fresh in everyone's minds, right? They have just done the exercise. So people knew what to do, but they were silenced by the politicians for whatever reason. And I think that really is what hurts the most, because I think when you watch the film, you see Dr. Rick Bride and Scott Becker get emotional, and that's because I think that comes from this inability, like knowing what to do, but not being allowed to do it. I think that hurts. And I think I'm Fiana and Kristin, I'm really sorry for your loss. And I think it's terrible for you to think that if there was a different leadership, my mom would have been alive, and no one should even wonder that, and no one should even question that. And I think I would love to hear from more scientists, hopefully later when they're not silenced, to hear about their experiences of how they were coping with not being able to speak up. But at least the people that we spoke to definitely struggled with the idea of like knowing that they can help, knowing what to do to save lives, but not being allowed to.
At the end of the film, and as we all learned just a month or two ago, it's revealed that Trump knew all along that this disease was much more severe and much more easily transmissible than he was saying, especially in those early weeks. This is a question for Kristin and Fiana. Knowing that he knew that, how did that make you feel watching the film?
I can kick us off. I mean, when that news broke that he knew, I think that many of us who've experienced a COVID loss were not completely surprised, but it was still shocking. It felt like a knife in the back on top of a wound that already was open and existed. And I was really happy that the film was able to include that into it, because I think it did a really good job of telling this fuller picture of this is science versus politics during the largest public health crisis ever. And for me, I, walked away from watching that film thinking to myself, at what point are we allowed to start calling this biological warfare? Because that's what it seems like to me.
I absolutely agree with Kristin. It felt like my mom had died all over again. Even though I wasn't surprised, I kind of knew he knew, but it just felt like I had to go through the death again. And I'm having a hard time understanding how the President of the United States had so many chances and opportunities to lead, and he chose not to. And it's hard for me to accept it and understand it and grapple with it. And so just hearing those tapes, it was hard. And so I think in watching the film, I could see why he did it. It doesn't make it easy. It doesn't make it make sense, but I can see why he did it. He did it for himself because he wanted to protect his image. He wanted to protect his reelection strategy. And yeah, it doesn't make it easy to accept, but I can see why he did it.
Ophelia, my next question for you has to do with that tension between science and politics as well. Your film, unlike the Trump administration, elevates the voices of scientists. As a director, you seem to have made a deliberate choice to really include in-depth interviews with infectious disease experts, with virologists, with epidemiologists. Sometimes I think that there's an assumption that people don't want to listen to scientists talk, that their eyes will glaze over, but I've found these interviews riveting. Can you talk us through the choice to focus on scientists and how you made their testimony so compelling?
Yeah, I mean, we felt it was important to understand the facts and the details in order to understand that there could have been a better response, that we could have done better. I think it's crucial. For example, one could say, oh, why spend so much time on testing and understanding all the different components? But for us, it was important to explain what the issue was with the test and how easily it could have been fixed, and what the other options were, to show the inaction and to explain that, no, we could have done better. And so for us, as filmmakers and in terms of doing research, it was crucial for us to understand and when we did that and we realized how important to get to know all of this, to get the bigger picture, we decided to include it in the film because I think the details are important. And I think the feedback that we're getting from the viewers is that they do appreciate, like you said, getting all these facts and hearing it from the scientists and hearing it from the experts to understand what went wrong, what we could have done better, etc. So that's the reason why we included those interviews.
And I have a kind of a follow-up question. To me, one of the most fascinating interviews in the film is Dr. Eva Lee. Her mathematical modeling basically predicted this pandemic. Can you say a little bit more about her work and about what you thought her voice would add to the film?
Yeah, I mean, she's amazing, and she's a big expert in her field, and so she does this. She's very smart. She has her models, and very early on, she was on top of it. She had already done she had done the models, and she had seen that, okay, if there are these many cases, right, as she says in the film, there must be many, many more that we're not seeing. So she was very concerned from the beginning. There's a very interesting story that she was actually invited to a conference in January to New York. She lives in Georgia, and this was early January, and she refused to fly because she said, there's this virus, it's dangerous, I'm not going to fly. And so this is a person who in early January knew that this is going to be bad, we need to take this seriously. And unfortunately, she wasn't the only person. There were a lot of people sounding the alarm and saying, take this seriously, this is going to be a pandemic. And so it was fascinating to talk to her and learn about all of this, but it was frustrating to know that the information was there, and the information, I mean, the Red Dawn email chain, I mean, they were trying to include people from the government. At some point, Redfield was on that chain, Cadlick was on that chain, people who could make a difference, people who could make decisions to take it seriously, and it was very unfortunate that the information was out there and wasn't used. But in terms of Dr. Eva Lee, we felt her voice was important, not only for her, I mean, A, because she was in the Red Dawn email chain, and we wanted to talk about those group of people who were sounding the alarms, but B, also she was such an important expert in the field.
Yeah, her work is fascinating. I thought that her voice just added so much to the film. For Fiana and Kristin, what were the most surprising revelations or the most interesting revelations of the film for you two?
I can go first. There were, even though I had known a lot of what happened in the film, I was still surprised. I think the one most surprising revelation for me was that there was a 69-page playbook for dealing with a pandemic, and that it was created by the Obama administration and it was handed to the Trump administration. So they had a guide for this. And they chose to toss it out and rewrite their own. And, and they went on defense and completely disbanded the Global Health Security and Biodefense Council. I cannot believe we had a playbook for this. We had guidelines. And I think that was the most surprising for me.
For me, I just cannot believe that Jared Kushner was in charge of a PPE supply chain task force that was staffed by a group of 20, however many 20-year-old volunteers who were called to duty, but yet didn't have the skills or the support to actually follow through on that simple task. I had known that the Trump administration had dragged its feet on implementing the Defense Act to help create PPE. I knew there was a shortage, but just seeing this again, another sort of brazen approach to this handling of the pandemic of, because I'm in charge, I'm just going to do it my way, versus actually going to the playbook, like Fiana had mentioned, like actually going to scientists that have been highlighted in this film, but others all across the country who were looking at this slow moving train wreck and in unison saying, if we do not do some simple measures right away, this is going to be a catastrophe. And that's exactly where we've landed.
So at several points throughout the last few months, Trump has said that the United States is doing a better job responding to the pandemic than any other country. And Ophelia, this film does this very deliberate thing where it compares the US response at several moments to Korea's response. Can you say a little bit about why you and the other directors chose to make that comparison, and what you learned from looking at these two countries' very different pandemic responses side by side?
We thought it was important to compare to a country who had done better, to show that this was a possibility that we could have done better, first of all. Why we chose South Korea was first because it was such a weird coincidence that the first case in both countries was discovered on the same day. And so we were looking at, that was the only similarity, right? It was just the same day we find the first positive patient, and then from then on, both countries just went in very different directions. So that was the second reason. But also, South Korea is quite urban. Their politics is also quite polarized, and so we were interested in looking at a country that also has this kind of divide, to see how they whether they were able to put that aside and actually respond as a unified country. And actually they were able to put politics aside, which was very unfortunate that we weren't able to do that in the States. But it was just, once we started doing the research, it was just fascinating how what was important in their response was that they had learned from their previous mistakes, right? They also had a playbook, and the playbook was written after the MERS outbreak. And like us, they knew what to do, and they did it. Whereas we had a playbook, we had previous outbreaks, we had tried to learn on, based on those outbreaks, but our administration decided to put all the knowledge aside and start from zero, saying that this has never happened before, we don't know what to do, we're going to learn what to do. So I think that was really the major difference of just how these countries handled the response, was just that. South Korea did not shy away from using the previous administration's mistakes, even, because the response to the MERS outbreak was really bad, and the president at the time, the prime minister at the time, I think she even resigned or she was impeached, and so they learned from the mistakes of the administration that came before them, right? You don't necessarily need to stick to what they did well. We could have done the same, but we didn't.
It was interesting. You have a journalist, Caroline Chen, talking about South Korea's response and comparing it to the United States. And she made a comment at one point where she said, South Korea and many other countries used to look to the United States as a leader, as this kind of ideal of what a nation could be. And everybody just watched in horror as the Trump administration so badly botched the pandemic response. So kind of going off of that, my next question for Kristin and Fiana, after you went through losing loved ones to COVID-19 and watching your leaders let this happen, has that changed how you feel about being American?
I feel like I have become more American, actually, over the course of this, to be honest with you. So my dad identified as a patriot. He taught me to love his country and love our country. And part of that for me is upheld in the actual principles in the Constitution of being able to create opportunity for folks. And what I see happening as a course of this pandemic is playing out all these ways in which we are not living up to our American ideals. But the thing that I think about, and I think a lot of what has inspired me to be vocal, is that this country was built by people speaking up and demanding what was right. And so it is our time to do that, to ensure that what we leave behind for Fiana's daughter, Lua, and others is a place that really upholds those values of equality and justice for all. And so this whole pandemic and losing my dad, I think it could have had one of two outcomes, me wanting to run away or me wanting to lean in. And what I see is just an opportunity to not only stop this crisis from continuing to unfold the way it is, but to demand better for all of us to ensure that we are in a much better place once we're on the other side of this.
I love Kristin's outlook, and I'm going to adopt some of it because it's been hard for me, to be honest. My mom was a very proud American. In fact, after she died, my brother and I found journals of hers, and there were pages and pages of how proud she was to be an American and her love for America. And in fact, July 4th, the day that she died, was her favorite holiday. And as a result, it was ours. We loved watching the fireworks and waving around our flags and spending time together as a family and having barbecues. That was my favorite holiday, just like it was hers. And that she died on that day has really affected me, because I'm reminded of how Americans have been, claiming their right to liberty when it comes to not wearing a mask or following the CDC guidelines, how they're claiming their right to freedom. And that very claim to freedom ultimately killed my mother. And it's hard for me. I don't want to turn my back on America, but I am embarrassed. I think it is very sad that we are in this great country and we have so much opportunity, but right now we are just suffering and struggling, and I'm having a hard time loving it. But as Kristin said, what I think is is great about, what we're doing is that we do have a voice and we do have the opportunity to speak up. When I first started on this crusade with Kristin, I thought, who's going to listen to me? And I don't know if anybody's listening to me, but I have been given a platform to speak and to share my thoughts and to share my opinions and to share my mom's story. And I appreciate that. And so I do think this is an opportunity, because we are in America, to help turn it around and to be the strong voices and helping others know that if we stick together, we'll be okay.
That's actually a great segue into some questions that we've gotten from the viewers. So this is also a question for Fiana and Kristin. What steps can the federal government take now that would make a difference? That question comes from Henry Schneider.
You want to kick us off, Fiana? Okay. There's a couple of simple things. First and foremost, we need a coordinated, data-driven national response. That's going to take a little bit more than an overnight agenda. But that being said, like we know from this film, there is a playbook by which to respond to pandemics. And in the meantime, we need to mandate masks. We know they work. Science is out there, not only that they work, but that if we implemented a mask mandate now, we would reduce deaths by 100,000 between now and the end of the year. That is remarkable and something that needs to happen right this moment.
That's my thing. It's mask mandates. I don't understand why I'm still having debates with people about the effectiveness of masks when it is clear that they work and it is clear that they can save so many more lives. And if we just had leadership who wore masks and promoted masks and didn't make this a political issue, my mom probably wouldn't have encountered a visitor at her hospital who said, why should I wear a mask if my president doesn't wear one? And that should not be a discussion or anything at this moment. We are in the middle of a global pandemic. Masks save lives, and it doesn't hurt you to wear one. Even if it's 15 minutes a day, if you're outside, just wear a mask to save other people. That's what I think we can do now.
We have another question from Henry Schneider for Ophelia. What do you wish you could have included in the film that you didn't have time or that took place after you finished it?
Well, we finished it very recently, so I guess we honestly, when we started working on the film, we knew we wanted to concentrate on the early days. So we wanted to, because we knew those were the first 2-3 months was the time when we needed to act. And after that, the virus was out of control. And if we didn't do what we needed to do in those months to contain the virus, then we were mitigating and we were trying to catch up with the virus, and that was too late. So in a way, we weren't trying to catch up with the news, right? We were looking at those first. I mean, the working title of the film was 100 Days. We were initially just going to look at the 100 days. Granted, I mean, we did include some things that happened afterwards, but those were all connected to trying to still understand the early days, right? The Bob Woodward tapes. Those were confirming that the president knew in early February how dangerous the virus was. Or we included a clip from the president at one of his rallies, I think in May, I can't remember exactly when, but he was saying, I said, slow the testing down. I mean, that we included that clip because we wanted because it was basically proof that early on the government was intentionally slow walking testing. And so, we finished the film, and then a day later, the president announced that he had tested positive for COVID. I don't know if we were to include, I mean, we did add a card addressing that. Obviously, we opened up the film, but I don't know if necessarily we would want to necessarily include everything that happened after he tested positive, just because it was, honestly, it was such a shit show, and I can't believe we lived through that, and we're still living through the consequences of that, of the president not only not taking it seriously, but actually changing his messaging to worse, which I didn't even think was possible. And so I think that is like a whole other movie. Maybe if we were to include that, this would be like a 3-hour movie. But I feel like what we would have wanted to include and didn't manage to include, not because of time constraints or that we had finished the film, but really just people that we wanted to talk that we were not allowed to. I mean, we wanted to talk to people in the CDC. We talked to people, like we wanted to talk to the Health and Human Services Secretary and Dr. Redfield and Dr. Messonnier and Dr. Fauci. I mean, these were people that we really wanted to talk to, but we were not, granted permission to. And so that is one thing that I hope, I wish we would have had in the film.
If you could choose just one person to see this film, who would it be?
Just one person.
Mm-hmm.
Oh, that's a really good question. I think even if one undecided voter sees this film who maybe still has questions about how the pandemic was handled, or maybe they think that we couldn't have done a better job, etc. And a person, if someone could watch this film and see the reality of it, and I strongly believe in the word of mouth. I strongly believe from hearing from people that you trust. If a Trump supporter or an undecided voter saw this film and really gave it a chance. I've seen a lot of reviews where people say, I watched the first 10 minutes and then the last 10 minutes, this is propaganda, right? Like, no, if you really give the 2 hours and you sit down and you watch the film and you really take in the facts, I really believe in the power of media, the power of films and power of documentary filmmaking. I think even if one person, one undecided voter or Trump voter could watch the film and actually take in the facts and tell their families and tell their friends, I think I would take that.
My closing question is for Kristin and Fiana. If you two could tell President Trump one thing, what would that be?
Looks like I'm going first. That's a tough one. One thing. I think I would tell him. I mean, I would tell him that this is a true fiasco. I would tell him that because of his inaction, that my mom is gone now. My daughter's grandmother is gone, and that there was more he could do. And look, I don't know if he would listen to me or not, but I would just keep my message very simple and say, you belong in jail. You belong in jail for what you've done to the 220,000 Americans and the other Americans who will die under your watch.
Along a similar lines, I think the thing that I would tell the president is that my name is Kristin Urquiza. You are responsible for the death of my father and over 220,000 other Americans. And it is now my life's mission to ensure that you end up in The Hague and that you live out the rest of your days in prison.
This has been such a powerful conversation. Thank you so much, Ophelia, Kristin, and Fiana, for sharing your insights and your thoughts and making such smart points and incisive comments about the film and about this tragedy that we're all living through. I wanted to let you know before you go, viewers, that Neon has partnered with Mother Jones so that our readers can view Totally Under Control at a discounted price. You can go to watch.neonrated.com/film/Mother-Jones. I'll say that again. Watch.neonrated.com/film/Mother-Jones and use the code MJVOTE to receive $1 off the rental. You can follow Mother Jones's ongoing coverage of the pandemic, the election, and more at motherjones.com. And please also check out the Mother Jones podcast on iTunes, Stitcher, or wherever you get your podcasts. Thank you so much to our panelists, and thanks everybody who tuned in to watch.